I would like to see what you're doing.
You're gonna watch it on YouTube, but not on this.
I'm
not
afraid
real life.
that if I watch you do it now, it might not be pretty.
No problem. So all I'm doing right now is just wiping down the toe.
Yeah.
So we're gonna do the injection part first. So how it works, you're gonna feel pinch and sting on 3. If you feel like moving your foot, don't. Just push your heel like this down to the chair.
All right.
If it hurts, and then it will go down pretty quickly. Okay?
Yeah.
Okay, so here we go. Just a little pinch. 1, 2, 3. Very good. And just good breathing. You okay? Mm-hmm. I know it's a wake-up call.
Oh boy.
I actually think the little toes are worse than the big toes.
Oh, yeah. No kidding.
You doing okay now?
Yeah. I'm
Calming down a little bit?
I'm trying to breathe and go to my happy place.
Okay, one more side, okay?
On the beach somewhere.
Here we go.
Baby. Oh.
I'm sorry, I'm sorry.
Okay, it's okay.
But to tell you the truth, you didn't even flinch. You were good. You are good.
I'm going to rip these arms off the chair in a minute, though.
Try your best. That's the challenge.
Oh, man.
No one's done it yet. You could be the first.
Oh.
Coming down a little bit?
Yeah.
Okay.
Actually, yeah, it's good now.
Very good. So normally I would inject closer up, but because I don't know how far that growth is,
Yeah.
that's why I did have to inject a little bit
Okay.
further away from the tip of the toe.
Yeah.
So it was a little bit
yeah.
tougher, but you did really
no,
well.
That's okay.
I can kind of see how far that bump goes back,
Yeah.
just around to where the first knuckle is.
Yeah, it looks like it's down pretty low, like far
It is.
down.
But when your doctor looked at it, he said, I'm going to get it cut out, give me the jar, and she's like, no problem, huh?
Yeah.
Awesome.
Well, she looked at it and she thought it was more like a wart.
Yes, you
I
said that,
told
yeah, you did. And you were
And she did the
liquid nitrogen?
yes.
And what we discussed is that could just be making it
Yes,
worse and worse
make it
and worse.
Yeah, it didn't really do a whole lot for it.
No. And so, luckily though, your nail hasn't been too damaged underneath. The nail is actually intact.
Mm-hmm.
So really, what I'm going to do is bring in a tray, set everything up, and then what we do is, do you mind if I tell you quickly?
Yeah, no, that's fine.
I'm just making a small little incision or cut on the side of it.
Yes.
Lifting up that flap of skin, pulling out that little growth.
Okay.
I have a cauterizer just to burn any
Yes.
ends, and then
Yes.
we sew it up.
Okay.
That's it.
How
Okay.
many stitches fill up?
Depends how far I go down, but it's
Okay.
probably going to be between 1 to 4 stitches.
Okay.
Okay.
Yeah.
Okay, you did really well. That's the hard part though for today.
Oh.
You want cold water? I've been doing feet for, this is the end of my 6th year, but I grew up watching my dad do this.
Oh yeah. Oh, your
Yeah.
father was a.
He was a foot specialist for
Yeah.
over 30 years.
Oh, so you followed in his footsteps? No pun intended.
Yes. It makes me laugh no matter how many times
Yes,
I hear
I
that. I
know,
love
I
it.
know,
I love
I
it.
know.
So how many times have you had that little bump or growth frozen?
On the toe?
Yeah.
Frozen? Never.
Like with the liquid nitrogen.
Oh, twice. My podiatrist did it a while back, and then the doctor did it a few weeks back.
Yeah, and really just didn't help.
Yeah, no. Probably made it worse, but
How many years do you think you've had it?
I want to say, I don't know, a year and a half maybe,
So it's not too old.
maybe 2. I just never, I never thought much of it. So.
But it was much smaller before?
No, it was pretty big the whole time. Like I said, it would come up and then I would kind of poke at it and make it bleed, and then it would go down, and then it would slowly build back up again.
So what this growth normally is, it's some sort of thickened tissue. Think of it almost like a scar tissue, call it like a fibroma. And it's just this hard skin growth that normally happens because of trauma.
Okay.
So people bang their toe, drop something on the toe.
Yeah.
You had a feeling maybe it could be even from a pedicure.
I think it might have been from the pedicure. I think he cut the skin sort of thing, and it Because I don't remember like really banging my toes or.
So I'm just putting a little tourniquet on here. And so remember, pressure is completely normal,
Yeah,
but shouldn't feel anything sharp.
yeah. I'll let you know if I do. Don't you worry.
No, you're not a shy one.
You'll be hearing from me. I have a pretty good pain threshold.
Oh, considering everything you've been through, right?
I think I do. I don't know.
So once this piece is gone, it really shouldn't be bugging you. It shouldn't grow back. We're going to get the majority of it out.
Yeah. So it'll go back
To normal, yes.
pretty well normal like the other toes?
Yes.
Okay.
Luckily, your nail hasn't been too damaged.
Yes, yeah.
I've had other people where the nail has become deformed.
Yes.
But in your case, that's not how it is.
Yeah.
Any pain here?
No.
Very good. But yeah, I'm pretty curious that they said that they thought it was a wart.
She said it was a wart, and I said, I don't think so.
And how come you didn't think so?
Warts usually have they look different, don't they? And they have a core or whatever that you can dig out. Well, I guess you're digging this out, but I don't know. I just didn't think it was a wart.
Well, yeah, that's a good feeling you had.
Yeah.
So warts usually just live on the top layer of skin.
Uh-huh.
They don't really go deeper than that.
Yeah, yeah.
So they got a nice big bubble here. And so the goal for me is just to kind of travel back to see how far that's connected to anything lower.
Okay.
Any pain?
No, I'm watching you.
You are.
Yeah.
It's the hardest
Can't
part.
see much, but. So are you going to be a podiatrist or a chiropodist or?
Don't know.
Don't know. You're just kind of
She's way too smart. Like I said, she wants to become
feeling around on what you want to do.
yeah.
Yeah.
I think she's going to become a big specialist.
Is this like a placement sort of thing, or?
No, her parents are both patients, and they said we want this smart girl to come
Okay.
spend some quality time with you working. I said
Oh,
no
all right.
problem.
So you're going to university then?
Yeah,
Where do you go?
Went to Western for
Oh,
medical
right.
science.
Oh, nice. First year or, yeah.
So I've traced it back to where it's kind of coming from.
Okay.
It doesn't go too far back. Pretty much the bump that you could see on the top,
Mm-hmm.
that's where it was coming
Oh,
from.
that's it. It's not down too
No.
far. Okay.
So there it is right there.
Ew. That looks lovely.
So when we open that jar over here, so you can
Like
see.
I'm in some weird science experiment. Here's my toe.
There's a little piece. Pretty thick, like a little rosebud.
Yeah. Well, it's good to biopsy it though, just
For
in
sure.
case.
And so what we'll do,
I know someone that she ended up having cancer in her big toe. And they
Really?
had to remove her big toe.
it's not very common.
No, I didn't think so. I know you can get skin cancer on your toes, but for whatever reason, they had to take her whole big toe. And I guess that would affect your balance and
For sure, big toe,
yes,
it plays a big
toes are
role.
not good. Big toes and thumbs.
The ones in the middle aren't too bad.
Yeah.
So I'm just going to dry this area up. I don't see anything else that's in there. It was literally
Okay.
just sitting on the
Okay,
surface.
it's more surface. Okay.
So we'll see if we can get a nice look of on the camera what it looks like. So the nail bed, I'm sure you're going to be able to see when you watch your video,
Yeah.
which is pretty cool. But the nail bed is right down here, and that's where the growth was sitting on.
Okay.
And that's why the nail was kind of growing a little funny, like being
Oh,
depressed.
yeah, it felt a little funny on the one side.
But that's about it.
I started watching one of your videos, but I turned it off pretty quick.
Yeah. I'm just
Some
gonna.
man was getting his ingrown toenails, and he was screaming and crying
Sounds like fun, huh?
like a baby. I thought,
Oh
I'm
yes,
not
when he was
watching
getting his
this.
injection done.
I'm not watching this.
I just want to clean up that tissue,
Yeah,
just to make sure nothing was left behind
all right.
and reduce any sort of regrowth. Let's flush that area. And that's literally it.
Yeah, that wasn't so bad.
Very good.
I'll get everything fixed up before I go on my big holiday.
I know, when's that?
The end of September.
Okay. Luckily, it's not too much of a big area.
Okay.
You're probably going to just need 2 or 3 little ones, and that's it.
Okay. Are they dissolving stitches?
No. So what's going to happen, we're going to come
You'll
back.
Take them out.
Yes.
Okay. Is that next week you're going to do that?
No, so
Oh.
they're going to sit a little bit
Oh, okay.
longer than that.
Because I do have a follow-up with you on Wednesday.
Yep, so we come back in a week
Yeah.
just to make sure everything's okay then.
Yeah, and then you take them out, what, in
2 weeks after that.
Okay.
We're going to take those scissors there.
Okay.
Perfect. And we'll trim that a little smaller after, but that's good. And all that for that little bump.
Yeah, I know. Crazy, eh? I've learned to get everything checked out now.
It's the right way to do it.
Yeah.
So it's normal for this to bleed a little bit.
Okay.
Trim these down.
Even though you cauterized it?
Yeah.
Yeah. Okay.
Toes bleed quite a bit, but
Yeah.
if
I
it
know.
bleeds through the dressing, you just take everything off
Yep.
and put a new dressing on.
Okay.
So I'm going to put a little bit of gauze
Yep.
after we take off the tourniquet.
I have lots of.
So sometimes the best thing to do is just to put on a Band-Aid.
Okay.
So you put on the cream
Yeah.
and a Band-Aid, and that's about it.
Okay.
I'm going to wrap the 2 toes together
Okay.
just because it's easier to
Yeah.
hold the dressing
So should I
together.
leave this on for today and.
Yep, usually we leave it till tomorrow morning.
Okay.
Then you can take it off and then you can do your first dressing yourself.
Okay.
Antibiotic cream
Yep.
and the Band-Aid.
Okay.
Then we come back in a week just to make sure that everything's
Yeah.
looking good, which you already have it booked.
Yeah.
Then we come back 2 weeks later to remove the stitches. Do the 2 toes together because then the
Yes.
toe won't bend as much.
Okay.
Less
Okay.
bending, the better.
Okay. Yeah.
We'll have this, we have the little thing. It's hard to see, let me see if we can focus. The little growth
That's
is in
in
there.
there?
Yeah, it's in
Okay.
there.
That's going off to the doctor.